welcome back to the Deep Dive. Today, we're tackling something that can seem pretty daunting at first glance, but is so important for, well, everyone. We're talking about spotting those early signs of cancer and knowing when it's time to seek help.
You hit the nail on the head. It's all about empowering ourselves with the right knowledge, right?
Exactly. And that's why we're diving deep into the NICE guideline on suspected cancer, recognition, and referral, which was just updated on April 7th, 2025. This is like the gold standard guidance for healthcare professionals.
It is. And while it's super comprehensive, it can be a bit of a beast to get through.
That's where we come in. We've sifted through it all, extracting those crucial nuggets of information so you don't have to.
We're talking about the key indicators that might suggest cancer, the pathways for getting referred to specialists, and how all of this applies across different types of cancer in different age groups.
Think of this as your cheat sheet to understanding what truly matters in this document. We'll break it down into manageable pieces, making sure we hit those key takeaways without getting bogged down in the nitty-gritty details.
Because, let's face it, while being thorough is important, it can also be totally overwhelming.
Absolutely. So let's get started.
Sounds good.
First off, this guideline isn't just about hard and fast rules. It's more like a really well-informed guide for healthcare professionals.
Right. It lays out the best available evidence to help doctors and nurses make those critical decisions. But it also recognizes that every patient is unique.
Meaning it's not a one-size-fits-all approach.
Exactly. Healthcare professionals are encouraged to use their own clinical judgment alongside this guidance, always considering the individual needs, preferences, and values of each patient.
So it's about having the best information, but always tailoring it to the individual.
Precisely. Now, one thing that's really emphasized early on in the guideline is the importance of the yellow card scheme. Have you heard of this?
I have, yeah. It's how we keep track of any unexpected or adverse reactions to medicines or medical devices.
Exactly. If someone experiences a side effect or there's a concern about a device not working as it should, healthcare professionals are encouraged to report it through this scheme to the MHRA, the Medicines and Healthcare Products Regulatory Agency.
It's a way to ensure ongoing safety and to spot any potential issues early on.
Absolutely. Now, the next part is interesting. It highlights the responsibility of local commissioners and providers.
You mean the organizations that plan and deliver healthcare services?
Exactly. They need to ensure that this guideline can actually be put into practice. This means making sure there's enough funding for the necessary services, developing those services in a way that meets local health needs and national priorities, and also considering fairness and reducing inequalities in health when they implement these recommendations.
It's about that bigger picture thinking, making sure the system is working as it should.
Yeah. And there's an important point about how the guideline refers to gender.
That's something I wanted to ask about. I noticed that the guideline uses terms like men and women when talking about certain cancers.
Right. Now, it's important to clarify that while the language might refer to specific genders, the recommendations themselves apply to anyone who has the relevant organs.
So, for instance, recommendations about prostate cancer, even though they might be phrased in a way that seems targeted towards men, would also apply to a transgender woman who still has a prostate.
Exactly. It's about the presence of the specific biology that's relevant to the cancer risk, not solely about someone's gender identity.
That's a crucial point.
Big.
It's about making sure everyone gets the right care, regardless of their gender identity. The guideline also addresses the safeguarding of children.
Yes, and it's a reminder that, unfortunately, child abuse can occur and might sometimes be present alongside other health issues, even suspected cancer.
It's a tough reality, but important to be aware of.
Absolutely. The guideline points to NICE's specific guidance on child maltreatment, urging healthcare professionals to be vigilant and recognize that these issues can coexist.
And at the heart of all this, the absolute core, is the patient themselves.
Couldn't agree more. The guideline strongly emphasizes that patients have the right to be actively involved in discussions about their health and to make those informed decisions about their care.
That means understanding what the referral options are, the potential benefits and risks of different tests, and even considering other possible reasons for their symptoms that might not be cancer-related.
Right. It's about giving them all the information they need to make those choices that are right for them. And this leads us to the concept of safety netting.
I've heard this term, but can you break it down for us?
Sure. Safety netting is essentially a plan for patients who have symptoms that could potentially be linked to cancer, but don't necessarily meet the criteria for an urgent referral or investigation right away. It's about monitoring and making sure nothing gets missed.
So it might involve things like scheduling a follow-up appointment to see if the symptoms have changed or improved, or advising the patient on what to do if their symptoms get worse, persist, or they have any ongoing concerns.
Exactly. It's not just a one-off assessment. There's a process in place for ongoing monitoring if needed.
And when a referral for suspected cancer is being considered, the guideline is very clear about the importance of having a thorough conversation with the patient.
And that includes anyone involved in their care, like their family or caregivers, if that's appropriate.
It's about making sure everyone understands what's happening and why.
Right. The guideline stresses that doctors should clearly explain the referral options, the potential risks and benefits of further tests, and also discuss other possible non-cancerous reasons for their symptoms. And importantly, it emphasizes the need to reassure patients that most people who are referred don't actually end up having cancer.
Reassurance can be so crucial in those moments of uncertainty and worry. What specific information should someone who is being referred receive?
The guideline outlines several things. Clear details about where they're being referred to, what the expected waiting times are, and who they can contact if they have any questions or haven't heard about their appointment yet.
It's about giving them that sense of control and knowing what to expect.
Exactly. They should also be informed about what to expect from the specialist service, the types of tests that might be done, how long it might take to get results, whether they can bring someone with them to appointments, and crucially, information about support resources that are available to them.
That's a really helpful and comprehensive list. So let's get into some specifics. We've talked about these general principles, but how does this translate into recognizing potential cancers in different parts of the body?
Let's dive in. Shall we start with lung and pleural cancers?
Sure. What should people be particularly aware of here?
Well, for lung cancer, a major red flag is unexplained hemoptysis. That's coughing up blood, which understandably is a pretty alarming symptom. And for anyone aged 40 or over who experiences that, referral through the suspected cancer pathway is crucial.
What about other symptoms that might not be as immediately alarming?
Right, so the guideline recommends offering an urgent chest x-ray, which should be done within 2 weeks, for anyone aged 40 and over who has 2 or more unexplained symptoms like a persistent cough, feeling really tired, shortness of breath, chest pain, unexplained weight loss, or loss of appetite.
And it gets even more specific.
It does. If someone has ever smoked and has even just one of those unexplained symptoms, they should also be offered an urgent chest x-ray. So the threshold is lower for those with a history of smoking, recognizing that increased risk.
Right. So smoking history is a major factor. Are there any other signs that might prompt an urgent chest x-ray in this age group?
Yes. The guideline suggests considering an urgent chest x-ray for people aged 40 and over if they have things like a chest infection that keeps coming back or doesn't clear up, finger clubbing.
Which is when the ends of the fingers become wider and rounder.
Yes, exactly. Or if they have certain lymph node issues, specific sounds or signs when a doctor examines their chest, or thrombocytosis, which is a high platelet count in the blood.
So those are all things to be aware of. Let's move on to the upper gastrointestinal tract. The esophagus, stomach, and pancreas. What stands out there?
For cancers of the esophagus and stomach, the guideline emphasizes the need for an urgent upper gastrointestinal endoscopy, which should ideally be done within 2 weeks. This is especially important for anyone experiencing dysphagia.
Dysphagia, that's difficulty swallowing, right?
Yes. It also highlights that for those aged 55 and over who have unexplained weight loss, along with pain in the upper abdomen, persistent heartburn or reflux, or dyspepsia, which is essentially indigestion, that combination of age and these digestive symptoms should prompt an urgent endoscopy as well.
So age plays a significant role in the assessment.
It does. What about pancreatic cancer? Any key signs there?
For pancreatic cancer, in those aged 40 and over, jaundice is a major red flag. That's the yellowing of the skin and whites of the eyes. If someone presents with that, they should be referred through the suspected cancer pathway.
What about other symptoms that might raise concern for pancreatic cancer?
Well, for people aged 60 and over who present with unexplained weight loss and new onset diabetes, or other abdominal symptoms like persistent diarrhea, pain in the back or abdomen, nausea, vomiting, or changes in bowel habits like constipation, the guideline recommends considering an urgent CT or ultrasound scan.
Okay, so those are some pretty distinct sets of symptoms to be aware of. Let's move down the digestive tract now. What about the lower gastrointestinal tract, particularly colorectal cancer?
This is where fecal immunochemical testing, or FIT, comes into play.
Ah, yes, FIT. It's a simple test that detects tiny amounts of blood in the stool.
And this can be a really helpful early indicator of problems in the lower digestive system, including bowel cancer.
Right. The guideline recommends offering quantitative FIT to adults who have an unexplained lump in their abdomen, a noticeable change in their bowel habits, iron deficiency anemia, or particular combinations of age and other unexplained symptoms like weight loss, abdominal pain, or rectal bleeding.
So a lot of potential triggers there. Is there a specific threshold that would warrant a referral?
There is. If the FIT result shows at least 10 micrograms of hemoglobin per gram of feces, that's a sign that a referral through the suspected cancer pathway is necessary.
Okay, so FIT is a key initial investigation in many cases.
It is. And there's one more thing to note. If someone has a lump in their rectum that can't be explained, or an unexplained anal mass or ulcer, a suspected cancer pathway referral should be considered, even without a FI test.
So those are considered serious enough to warrant a referral regardless.
Got it. What about breast cancer? What are the key things to look out for there?
For anyone aged 30 and over, an unexplained lump in the breast, whether it's painful or not, should prompt a suspected cancer pathway referral. And for those aged 50 and over, a new nipple discharge, a nipple that seems to be pulling inwards, retraction, or any other changes that are a cause for concern but only affecting one nipple are also significant.
So unilateral changes are key here. Precisely. The guideline also suggests considering a referral if there are unexplained skin changes on the breast that might indicate cancer, or if someone aged 30 or over has an unexplained lump in their armpit.
It's interesting how age is a recurring factor in these recommendations. Now, moving to gynecological cancers, what are some key things to note?
For ovarian cancer, if a doctor finds a site that's a buildup of fluid in the abdomen and/or a mass in the pelvis or abdomen during a physical examination, referral to a specialist gynecological cancer service is essential.
And what about symptoms that women themselves might experience?
Right. Well, if a woman, especially if she's 50 or over, experiences persistent or frequent bloating or abdominal swelling, a feeling of fullness quickly when eating, or a loss of appetite, pelvic or abdominal pain, or an increased need to urinate urgently or frequently, and these symptoms happen more than 12 times a month, further investigation is needed.
So a combination of those symptoms and being over 50 would raise a red flag.
Exactly. In these cases, the guideline recommends that primary care tests, including a CA-125 blood test and potentially an ultrasound scan, are carried out. What about endometrial cancer? Any key indicators there?
For endometrial cancer, the guideline is quite clear. In women aged 55 and over, any unexplained vaginal bleeding that occurs more than a year after menopause, that's postmenopausal bleeding, should lead to a suspected cancer pathway referral. And for women under 55 who experience postmenopausal bleeding, a referral should also be considered.
Okay, let's shift gears and talk about urological cancers, cancers of the prostate, bladder, and kidneys. What should we be aware of there?
Well, for prostate cancer, if a digital rectal exam reveals a prostate that feels malignant, that's a clear sign for a suspected cancer pathway referral. The guideline also talks about PSA testing, which stands for prostate-specific antigen, and digital rectal exams for men who are experiencing lower urinary tract symptoms, erectile dysfunction, or have visible blood in their urine.
So several potential triggers there.
Yes, and when it comes to making decisions about referrals based on PSA levels, it's important to take age into account.
Because PSA levels can naturally increase with age.
Exactly. The guideline actually provides a table with age-specific PSA thresholds to help guide those decisions. What about bladder and renal cancers?
For those individuals aged 45 and over, unexplained visible blood in the urine is a key reason for a suspected cancer pathway referral.
Especially if there's no urinary tract infection present, or if the bleeding persists or comes back after UTI treatment.
Exactly. Let's touch on skin cancers now. There are different types to be aware of, aren't there?
There are. For melanoma, which is the most serious type of skin cancer, the guideline recommends referral using a suspected cancer pathway if a suspicious pigmented skin lesion scores 3 or more on a weighted 7-point checklist.
What does this checklist look at?
It considers things like changes in the mole's size, shape, or color, as well as its diameter, and whether there's any inflammation, oozing, or changes in sensation. It also recommends referral if dermoscopy, which is a way of examining the skin with a special magnifying lens and light, suggests melanoma.
So those visual clues are really important.
They are. For nodular melanoma, which is a faster growing type, referral should also be considered. For squamous cell carcinoma, another type of skin cancer, any skin lesion that raises suspicion should also be considered for referral. And for basal cell carcinoma, which is the most common type and tends to grow quite slowly, a routine referral is usually warranted unless there's a concern about its potential impact due to its size or location.
So a lot of nuance there. What about head and neck cancers? What should we be on the lookout for?
Well, for laryngeal cancer, which affects the voice box, persistent and unexplained hoarseness, or an unexplained lump in the neck in people aged 45 and over, should trigger consideration for a suspected cancer pathway referral. And for oral cancer, an unexplained ulcer in the mouth that lasts for more than 3 weeks, or a persistent unexplained lump in the neck are also red flags.
It's interesting how neck lumps come up in several different types of cancer.
They do. It's a good reminder to be aware of any persistent lumps or swellings. The guideline also mentions the importance of urgent dental referrals for any unexplained lumps or red and white patches in the mouth. And for thyroid cancer, if someone has an unexplained lump in their thyroid gland, a referral should be considered.
Now, what about cancers of the brain and central nervous system? These can be particularly worrying because of their potential impact on essential functions.
You're right. For adults who experience a progressive but not sudden loss of central neurological function, things like problems with coordination or balance or changes in their thinking abilities, the guideline recommends considering an urgent MRI scan of the brain.
And if an MRI isn't suitable for any reason, a CT scan should be considered instead.
Right. Now, in children and young people, if they develop new and abnormal problems with their cerebellar function, which controls things like coordination and balance, or other central neurological functions, a referral should be made very urgently within 48 hours.
Okay, so time is really of the essence in those cases.
It is. Now let's talk about hematological cancers. These are cancers that affect the blood and bone marrow, like leukemia and myeloma.
Right. What are the signs to watch out for there?
For leukemia in adults, a very urgent full blood count, which should be done within 48 hours, is recommended if someone has symptoms like paleness, persistent unexplained tiredness, unexplained fever or frequent infections, swollen lymph nodes throughout the body, unexplained bruising or bleeding, or an enlarged liver or spleen.
So a range of quite general symptoms that could point to a problem with the blood.
Exactly. Now, for myeloma, which often affects older adults, the guideline recommends offering specific blood tests to people aged 60 and over who have persistent bone pain, especially in the back, or an unexplained fracture.
What kind of blood tests are we talking about?
These would include a full blood count, tests for calcium levels, tests to measure how thick the blood is, that's plasma viscosity or ESR, tests for paraprotein, which is an abnormal protein, and tests for free light chains, which are another type of protein.
And it's worth noting that those same blood tests should also be considered for younger people who have those same symptoms, even though myeloma is less common in younger age groups.
Right. And what about in children? Are there specific red flags for hematological cancers?
The guideline highlights the need for a very urgent referral within 48 hours for neuroblastoma or Wilms tumor in children if a doctor can feel a lump in the abdomen, or if an abdominal organ seems to be unusually large. For Wilms tumor, unexplained visible blood in the urine is also a red flag.
So those are some serious signs to watch out for.
They are. And for retinoblastoma, which is a type of eye cancer, a referral for a specialist eye assessment is needed if a child has an absent red reflex in their eye. That's the normal red glow you see in the pupil when you shine a light into it.
Right, I've heard about that one.
For leukemia in children and young people, unexplained pinpoint bleeding or an enlarged liver or spleen are reasons for immediate assessment by a specialist. And a very urgent full blood count should be done if they have symptoms like persistent fatigue, unexplained fever or infections, bone pain, unexplained bruising or bleeding, or swollen lymph nodes throughout their body. So a lot of overlap with the adult symptoms, but with a lower threshold for urgent action.
Which makes sense. It's important to act quickly in children because things can progress more rapidly.
Absolutely. The guideline also discusses non-site-specific symptoms.
These are symptoms that could potentially be linked to a range of different cancers, rather than specifically pointing to one particular area of the body, right?
Yes, exactly. And for unexplained weight loss or loss of appetite in adults, the guideline emphasizes the importance of looking for any other clues that might suggest a cause, and to consider urgent investigation or a suspected cancer pathway referral.
So weight loss isn't something to ignore.
It's definitely something to take seriously. The guideline also points out that for deep vein thrombosis, or DVT, that's a blood clot, usually in the leg urgent investigation or referral should also be considered. DVT can sometimes be linked to certain types of cancer.
So it's another potential warning sign.
It is. And importantly, in children and young people, the guideline stresses that any concerns raised by parents or carers about their child's health should be taken seriously.
Even if the child's symptoms seem quite minor on their own.
Exactly. It's about trusting those instincts and erring on the side of caution.
It's so important to listen to those who know the child best.
Yeah.
Now, you've mentioned different levels of urgency for referrals several times throughout this deep dive. Can you just clarify what those mean?
Sure. The term suspected cancer pathway referral means that the goal is to either confirm a diagnosis or rule out cancer within 28 days of the urgent referral being made by the GP. Then you have urgent, which generally means an appointment or investigation should happen within 2 weeks.
And for certain very concerning symptoms and findings.
Particularly in areas like neurology and for some childhood cancers, you have very urgent, which means the patient should be seen by a specialist within 48 hours.
So it's a way of categorizing how quickly action needs to be taken. The guideline also touches on the importance of good communication and follow-up, right?
It does. If a healthcare professional is unsure whether a referral is needed in a particular case, the guideline recommends discussing the case with a specialist to get their advice.
That makes sense. Two heads are better than one, especially when it comes to complex medical decisions.
Absolutely. It also stresses the importance of having systems in place to ensure that non-urgent referrals are assessed in a timely manner, that missed appointments are followed up, and that all necessary information is included in the referral correspondence.
So it's about making sure the process is as smooth and efficient as possible.
Exactly. And the final part of the guideline highlights areas where further research would be valuable.
What are some of the questions that researchers are still trying to answer?
There are several. Refining the age thresholds used for cancer referrals to make them even more effective, improving the accuracy of the initial tests done in primary care for various cancers, understanding better how well certain symptoms predict less common or less researched cancers like prostate, pancreatic, childhood, and rare cancers.
Trying to fill in those knowledge gaps.
Yes. And also understanding more about what it's actually like for patients to go through the diagnostic process, their experiences, their anxieties, their needs, and trying to optimize the strategies for PSA testing in relation to prostate cancer screening and diagnosis.
That's a pretty comprehensive research agenda. Yeah. Well, this has been an incredibly informative deep dive into this nice guideline. It's clear that a huge amount of expertise and careful consideration has gone into these recommendations.
It really has. And while we've covered a lot of ground today, it's absolutely essential to remember that this is just for general awareness and to help you understand the processes involved. It's not a substitute for seeking professional medical advice.
That's the most crucial point. If you have any concerns about your health, or if you're experiencing any symptoms that are persistent or worrying, please speak to your doctor or another healthcare professional. Don't hesitate to get those things checked out.
Early detection and appropriate referral are so important when it comes to improving outcomes for people with cancer, and this guideline provides a really valuable framework to help make that happen.
So, as you go about your day, take a moment to think about how this knowledge might empower you or the people you care about to navigate potential health challenges. Maybe it will even inspire you to explore more information from reputable organizations like NICE. Thanks for joining us on this deep dive.
It's just been a pleasure.
Until next time.